Hi everyone, it's your friend Doris Thecoder back with another video. If you are new to my channel, welcome. If you are coming, thank you for coming back. So in today's video, we're going to talk about aortography, specifically supravalvular aortography as it relates to the cath lab. So the image you see on the screen here is what an aortic valve looks like. Now there's two codes that are commonly considered when we're doing aortography in the cath lab. You might see this as a aortic root in the documentation. So supravalvular, breaking it down, just means above the valve. The specific valve that they're talking about here is this valve, right? So if this was in the right place, you'd see the valve here. This is the aortic valve. So a catheter is placed kind of right above the valve, and the injection is given. This information gives information about the valve, sometimes a little regurgitation, although they can do that from the left ventricle as well. And it can also give you non-selective coronary angiography. One of the tips to remember is contrast flows with blood flow. So where does blood flow when it leaves the heart? It goes everywhere. So the aorta is perfused, even though when it closes, it kind of does the coronary. The aorta is perfused, and every vessel that comes off as a first order is also perfused. So when you are in the cath lab and you've got aortography, two codes might be considered. I'm going to explain each one of these codes for you today. FYI, this program is Thecoder. I don't get any kind of remuneration for speaking of them, but it's a good one of the couple of programs that I use when I consider code edits and putting those together. So the first code is 36221, and this full description is listed here. So non-selective catheter placement, thoracic aorta, feels good, with angiography of the extracranial carotid, vertebral, and or intracranial vessels, one or both sides, and all associated RS&I, including the arch, right? So that's where our arch, you think, kind of comes in there. It is not uncommon for the providers to do an additional injection above the valve, like at the arch or the ascending aorta, and get information, right? So you might see aortic root injection, you might see ascending aortic injection, you might see arch. The second code that some consider when reporting this is 93567. So 93567 is an add-on code that goes only with, you can only put these with cath lab code. So wherein 36221 is a standalone, you could do it by itself, you could do it with other procedures. 93567, notice it has the list separately in addition to the code for the primary procedure. So that is what we see when it's an add-on code. Okay, so those are the two codes. This is what it looks like, right? So we inject here. Now, it's important to understand a little history here. So when the 3622 codes were created, and it's an entire range of codes. So let me just pull up that one code, and it should give me a range of codes. I'm going to use my other program, which is my encoder. Get into here, because this will give me my range of codes. Also why I have both of them, just because it's easier for me that way. So when I look up this one code, it's going to give me the range of code. This range of codes is what I'm talking about, 36221 to 36227, I believe. Yeah, 36227 as a standalone, or 36226. This whole range, all the way through 8, are the codes they created to study the cervicocerebral family. Well, what does that mean? Break the word apart: cervico, neck; cerebral, brain, right? So remember, contrast flows like blood flow. So I can, when I shoot in contrast into the root or ascending aorta or the arch, I can get information based, again, on where I shoot that. So if I shoot it here, all contrast is going to go here. If I go beyond the arch, I might not get as much information, but I can shoot contrast here and it will follow the blood flow. So when a provider is doing aortography, you want to ask yourself why they're doing it. What are they looking for? What are they studying? So the question posed to the CPT, and you can confirm this in the December 2021 CPT assistant, I posed this question to them to find out, what do you consider? Because we see this very often, and it's not a lot of work, but it's extra work. And because the codes read so specifically, right, the 93567 code reads supravalvular aortography, right, above the valve. Quite commonly in the cath lab, when they use, I don't know what this did. When they use this, that's meant for the root. We often see it as the root. But we may also see the ascending aorta. And if you look at that, you think, well, wait a second, the code doesn't say ascending aortography, but the ascending aorta is supravalvular. And again, blood flows with contrast. Contrast is going to flow with blood. So when we saw this so often, what you might see in your documentation, particularly if you code in the cath lab, and exactly the case if you code in the pediatric cardiac space as I do, when our providers do those injections in the root, again, the root could be for the coronaries non-selectively, the ascending aorta, or even the arch. They are doing that for the purpose of looking for things like MAPCAs. MAPCAs for clarities are aortopulmonary collaterals. This is when the heart, because of cyanotic or congenital heart disease, gets thirsty, and it can do it outside of that, but it starts to grow branches to get blood supply. So we pull from maybe the aorta, we could pull from other arteries like the subclavian. The pulmonary are trying to get blood into themselves. So it's almost like, imagine a tree that would just grow all these branches. That is what happens when a patient has MAPCAs or aortopulmonary circulation. In the congenital space, we're looking to see if those patients have that, right? So when we're shooting, we are not studying the vessels cervicocerebral. We're not studying the neck and the head. This is why often in the cath lab, you very rarely will see selective injections. Now, it's not uncommon. I actually coded one last week where they actually accessed the internal carotid artery and talked about the carotid circulation, right? Very rare that I see that, but I do see it, particularly in the cath lab. But because this code and the ones that follow the 3622 range, all of these here, were created for the purpose of studying the vessels of the head and neck, the CPT assistant has clarified as of December 21, that's your source article. So if you don't believe me, I have no offense to that at all. I tell you, don't believe me, because at the end of the day, what I said means nothing. You've got to be able to support how you code and what you code as a coder. They did clarify that supravalvular aortography 93567 can be used for the root, ascending, and the arch when the purpose of that is not to study the cervicocerebral vessels. So if you were coding prior, actually in all 2022, because this was the December 2021, you can safely use 93567. Now, here's the challenge. You use 93567, and unfortunately, this code has 1 unit of service that you can put with it. So you cannot do multiple units. Well, oh, well, no, I shot at the root and then I moved the catheter to the ascending, then I moved it again to the arch, and I shot contrast. And although that is true, very much like the add-on codes that go with the cath codes, 93563 all the way to 93568, you are only able to use those once as it stands right now. Now, if those rules change, then maybe that rule will change as well. So if you are coding, deciding between 36221 and 93567 in the cath lab, the tip I would give you is look to your documentation. You look to your documentation and you can't go wrong. So again, your reference is December 2021 CPT Assistant. If you don't have that, that is a subscription service. I would show you the article, but I don't want problems from the AMA. So I can't do that. But if you do, you can actually purchase a single publication from them. That single publication is the December 2021. Save that into your policies, write that into your policies if you need to, educate your team, and then you know what to do with it. So again, I'm your friend Doris the Coder, signing out with another video, and until the next one, I will see you then.